What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we are covering what do typical healthcare workers eat at the hospital for night shift versus day shift. So, this is both mainly an X-ray / nurse situation of my knowledge, because I'm an X-ray tech, my lady's a nurse. I've been doing it for 4 years, night shift mainly, but I work a lot of overtime, so I do dabble in days. So, it's divided into, I would say, 3 categories as far as food-wise. You have the typical Uber my lunch to me, which mainly happens during day shift or mid shift. Night shift, everything's almost closed, so you really don't have that option. So they'll Uber all the food to the hospital, which that alone, depending how big your hospital, that's like their own side mission of how hard it is to get the food to you. Because most people, even if you're very explicit in the notes, most normal people, when it comes to the hospital, they're lost. Like, they're very confused. So, like, it's the, like, people will order food and they'll end up on, I've seen it on so many different floors, so many different spots in the hospital. So, to get your food sometimes it's a venture on your own. So that's a headache that I personally don't like to deal with. So I don't do that. But that is one option, or the most expensive of all options, unless you gather some people and do a little bundle situation. But anyways, the next one is the good old, I brought food from home, brought my chicken and rice from home. That's kind of where the other set of people, which include me, most cost-efficient situation. Never had to worry about your lunch not being there. You just maybe forget. You have that situation. Most places have little microwaves in your own department, or they have a break room, or you can go eat at the cafeteria. They have a microwave for your food. So that's a situation that can be done. You also have the people who eat the cafeteria food, which is kind of limited to certain hours because they are open depending on your hospital for certain hours. During day shift, they get all the good cuisine making, and then afternoon is kind of what you get, the leftovers / more of a like fast food McDonald's situation, burgers and fries and anything deep fried. Not the most healthiest of options, I would say, but it is still the option nonetheless. And then, occasionally you'll have people that their families will bring them food and stuff like that. And on special occasions, the hospital will give their own workers, depending on what kind of holiday and stuff, they'll offer us free food. Or occasionally, people in certain departments, parties, or the doctors, if you work in the ER, sometimes the doctors will bring you food and stuff like that. So that's a certain situation. That's more of a special certain situations where you can get food like that. And yeah, it's been your boy Miguel. See you on the next one.